Well, one of the ideas that you helped pioneer is one I played a small role in too, and that was bringing prescription drug advertising to consumers on the television.
I'm ashamed.
Well,
Yeah.
there are people who argue both sides of this coin. I'm curious what you think now that the dust has begun to settle. Cialis is on the air.
I went to the FDA in Washington and sat down and passionately pitched the idea of allowing commercials for prescription drugs to be on television. They were forbidden until that time. The point of it was that the commercials were for physicians, and the FDA's concern was that there might be lay people watching. And they agreed to allow these commercials on the air because they thought that the doctor's programming would be so sophisticated that the public wouldn't have any interest in the programs, and therefore would not be exposed to these commercials for drugs. We scrolled all the fine print starting at midnight, and it was really, really ludicrous. Medical television didn't survive as we envisioned it, but the pharmaceutical companies saw a real opportunity and now direct these ads, commercials, toward consumers. They do everything they can to distort the reality of a drug. They even play music behind the warnings as loud as they can so you can't hear what they're saying. You will die, you will have diarrhea, you will vomit, you will have headaches. It doesn't matter. So I consider it a real farce. This is not where prescription drugs should be advertised, I don't believe. And I feel bad for my role in that. Not terribly guilty, but bad.
Well, there are people, several $1 billion a year are being spent advertising these things now. It overwhelms all other sources of support for education for the public.
And it does not improve the quality of health care in this country. I think it damages it.